So I would like to welcome everyone here this morning. This is a public service briefing for the Parry Sound area on the coronavirus or COVID-19. This briefing will be live streamed with recording available on the town's website and YouTube channel. We also have Cogeco Cable here, and we have Tom Mangos and his media group. We have the Moose FM here, and we have the North Star as well. The layout for today for the actual event will be I will make some opening remarks, and then I'm going to invite up Dr. Jim Scirocco, who's our Medical Officer of Health for Parry Sound North Bay. And he will take everyone through what the health unit and their role in this, which is the lead agency on this particular in an event like this. And then after Jim has done his presentation, then we'll have members of the health center come up and let everyone know what is going on within the health center itself and the role that they're playing within this event as well. So as far as the town of Parry Sound goes, we've been monitoring the COVID-19 situation since January. Internally, our focus has to ensure health and safety in the workplace and the public who certainly use our facilities. All of our actions are guided by public health experts. Actions taken to date include additional hand sanitizers have been made available, and we are installing dispensers in municipal facilities that don't already have them. Posters have been put up to remind staff and members of the public to practice good health and hand hygiene and hand washing to prevent the spread of the virus. Staff have also been advised to practice social distancing. We have instructed the cleaning staff to use appropriate disinfectant when cleaning municipal facilities, particularly the public spaces, and we are developing material including self-assessment information for staff that they can refer to when returning to work after traveling. Internally, we are meeting twice a week to monitor the situation, to take actions as required, and town staff are taking a lead in coordinating with area municipalities to support the health unit. And there are members in the audience today from a number of surrounding municipalities and other organizations as well that are here to be part of the event. So I will now turn the microphone over to our Medical Officer of Health, Dr. Jim Scirocco.
Thanks, Jimmy.
Yeah, right
there you go.
There
Good morning. I'd like to start off by thanking the town of Parry Sound and Mayor McGarvey for hosting this today. And start off by saying that it really is understandable that there are many concerns and fears around COVID-19 across the region, across the country, across the world. And it's normal to feel that way, especially when we're not sure what will happen. There's uncertainty. And it's important to remember that the risk to our community still remains low. The risk in Canada remains low. It is anticipated that it will end up circulating in the community, as it already is in many. And it's very sad that there will be deaths associated with it. So far, there's been one death in Canada. Fortunately, there are ways to help keep you and your loved ones healthy. Be informed, be prepared, be protected. This pandemic is ongoing. It changes rapidly. So it is important to stay informed, as recommendations may change. The Health Unit's website, www.myhealthunit.ca, provides trusted information and lists other reliable sources to help answer questions you may have. And it is also important to be informed about your personal risks and your families, and we can help you with that. Being prepared for emergencies is a good idea all of the time. Power outages, extreme weathers, those are examples of that. And it's a good idea to ask yourself, what would you need and your family need if you had to stay home for a couple of weeks? And again, The Health Unit has detailed information on our website to assist you with that. You can help protect yourself and the people around you by following simple hygiene practices such as washing your hands regularly, using alcohol-based sanitizers, not touching your face, covering your cough and sneeze, and staying home when you're sick. It is not recommended that individuals use masks to prevent COVID-19, as moisture can build up in them and they'd be really ineffective. If you develop a fever, cough, and or have difficulty breathing, and within 14 days of travel to an impacted area, had close contact with a confirmed or probable case of COVID-19, or close contact with a person with acute respiratory illness who has been to an impacted area, call the Health Unit or your healthcare provider. This will help keep the emergency room resources available for trauma and emergent care patients. If you do not need immediate medical attention, or if you do need immediate medical attention and you have, for instance, severe difficulty breathing, then you need to call 911, obviously. And mention your travel history if possible, and let them know what the situation is. People of all ages can be affected by COVID-19. However, older people with pre-existing medical conditions such as asthma, diabetes, and heart disease are much more likely to become severely ill. As a precaution, the Health Unit has asked all long-term care homes in our district to restrict visitor access to compassionate care only. The Health Unit also recommends that individuals monitor their own health before visiting older family members and do not visit if you are feeling unwell. When thinking about your March break travel, full stop, do not go on a cruise. For other travel, consider these factors: your destination, the number and severity of the cases, potential travel restrictions that might be in place. You also want to look at your own access to medical care and your own personal health conditions that might impact your decision on whether you go. I recommend that people visit the Public Health Agency of Canada's website for up-to-date travel advisories that might be in place. And also you can give the Health Unit's travel clinic a call if you need advice. It's important that you reassess daily to see what the situation might be. Ontario has closed all publicly funded schools for the 2 weeks following March break. If your child is not exhibiting symptoms, they do not need to be tested, and they do not need to be separated from others. We recommend that employers speak to their employees about options for sick days, when possible, to work from home if they are feeling unwell. You should not be going to work sick, just as I'm sure you would not want your coworkers to come to work sick. We also encourage employers to review the World Health Organization guide for getting your workplace ready for COVID, which we have linked to at our Health Unit website. Overall, we want to stress the responsible use of the emergency department. Again, testing isn't always necessary. There are no specific treatments for COVID-19, and there is no vaccine that protects against coronaviruses. Most people with COVID-19 will recover on their own. 4 out of 5 have either no symptoms or very mild symptoms. So you should just really monitor yourself and call your health care provider or the Health Unit and follow their instructions. Likely, you will be advised to stay home, separate yourself from others if you're symptomatic, limit your contact with other people, drink plenty of fluids, get rest and sleep as much as possible, try a humidifier or hot shower to help with a sore throat or cough. There are a lot of similarities with what we would do with the flu at present. This isn't the flu, but there's a lot of procedures and processes in place that can help you. Most people will be better in 1 to 2 weeks, similar to the flu. That's what we're seeing throughout Canada right now. Could it change? Absolutely. That's why you need to keep informed. And if you do need medical attention, it is there. They are preparing for this. And if you need to call 911 because of breathing difficulties, it's there too. And there will be people looking after you. So really, the summary of all of this is to be informed, be prepared, be protected. Thank you.
Thanks, Jim. We'll have Donald Sanderson from the West Parry Sound Health Center, and then Donald can introduce any of the other speakers that he has from his crew from the center. Welcome.
Thank you, Mr. Mayor. My name is Donald Sanderson. I'm privileged to be the Chief Executive Officer at the West Parry Sound Health Center and Lakeland Long-Term Care. We, making sure that our community, our staff, our patients and families are safe is always job number one, and we're prepared to deliver on that. We have, as of yesterday morning at 800 hours, implemented our incident command structure, and we are in real-time communication with our team and then meeting regularly throughout the day and formally at least once a day. I should introduce the other members of my team. Jim Hanna, who's the executive lead in charge of communication. Katie Hogue is our director of primary care, and Katie has been seconded to our COVID-19 response. And Dr. Will Smith is our lead anesthetist. He's the president of our medical staff and our acting chief of staff in Dr. Farger's absence. So I would ask Jim to say a few words in terms of our corporate response and readiness.
Thank you. And we would also like to thank the Town of Parry Sound and our partners at Public Health for this opportunity to be here, and to the media for being here. You are our partners in any crisis situation because you are a conduit to the public to bring important safety messages. So thank you for being here. Donald mentioned our incident command structure. We have an incredible amount of brain power in our organization. It's a standing room only meeting of leadership from every department, from clinical, housekeeping, supply chain. Our partners are in that meeting, both of our long-term care homes, our family health team, EMS, ACS, our nurse practitioner-led clinics. Dave Thompson has been attending those meetings as the person responsible for emergency response planning and our link to municipalities. So we are preparing. Lots of planning work is being done. Important messages for the public right now, and Dr. Chirico mentioned this, is judicious use of our emergency room services, that if you are really sick and you need our care, please never hesitate to come to Emerge or call 911 if you need care. But if you can look after yourself, if it's a mild type of illness, stay home and stay safe. The other important message, starting this morning, West Parry Sound Health Center is screening all visitors to West Parry Sound Health Center. All entry to the health center for visitors and members of the public are restricted to our front entrance, and of course, patients coming in our Emerge door. If you are accompanying a patient to our Emerge, we really require those people accompanying a patient to go through screening. Dr. Smith has one, I have one. We went through, and Katie has one. We went through screening this morning and we're given a sticker. So when we're in the health center, it's clear that we've been screened. And so any visitor to the public, from the public, will have to go through that process. People coming for an appointment, come a little bit early because you have to go through screening and then you still have to register as the normal process. But this is a key step in keeping our patients and staff and physicians safe. But it will be certainly an impact on our public, on our visitors. It's an unusual step, but it's a step that we're taking. Thank you.
Well, or Katie, did you have anything you wanted to say?
Sure. So thank you for having us. As Jim had mentioned, we have a single entrance currently for staff and patients that are entering the building. Next week, we're going to move that to phase 2, where we'll also have a separate entrance for staff to keep our staff even more healthy and safe away from people that might be getting screened and screen positive. People who have traveled and who are sick with symptoms we are required to report that to public health, so we do have that mechanism in place as well. We also have that mechanism in place at all of our nurse practitioner-led clinics And we are sharing resources and screening tools as well so that other people can be prepared as well in the community. Thank you.
Thank you.
Sure, thank you for having us. I don't have a lot of words prepared, but I would say, our incident command structure was activated yesterday morning. However, this is something that the members of the medical staff have been planning for over a course of several weeks. This is something that we think about a lot, we discuss a lot, we lose sleep a lot about it. I just want to let you know that this, for us, is an all-hands-on-deck scenario. We have learned the lessons from other jurisdictions, and we understand that one of the difficulties is going to be that resources will not always match the need. And we're working hard now to fine-tune our workflows and our processes so that we use our resources as wisely as we can. The message has already been given by Jim and by the rest of the team that this is not a process that has any specific treatment. There's no cure right now. And coming to the emergency department, if your symptoms are mild, will actually not be helpful for you and probably will not be helpful for the rest of the team. We really need to reserve the resources that are in the health center and the emergency department for more severe symptomatic cases. There's a very limited number of tests that we have available for us to use, and those will be used on the cases that are most severe. So, if you are experiencing only mild symptoms, you will probably not get tested, and the instruction, the same as has been already given out, is that you will probably be asked to be in self-separation or isolation at home until such time as your symptoms are fully resolved or 14 days past your exposure has elapsed. We are already asking our medical staff to reconsider all travel plans. I have a number of physicians on the team who have already canceled their travel plans, and we are planning ahead. We know that the human resources aspect of this will be huge for us, in addition to the resources, and we would ask everybody's understanding in our efforts to try and limit the number of people that do come to the hospital and to the emergency department to the people who really need it. And that doesn't mean that that business as usual doesn't continue. We will still see heart attacks, strokes, all the other things that we would see in the emergency department. What we would ask is that if this is mild symptoms for COVID related type issues, that you try to hold yourself back from coming to the emergency department. Reach out by telephone to the health unit or to your primary care provider. And that it will be a big step in and of itself in helping us deal with this as it evolves.
Okay, thank you. Yeah, you go right ahead.
I just wanted to further emphasize that I've noticed, not being from Parry Sound, but I've really noticed that we've been working together for a number of years, and that the community is really close-knit. And I noticed that, too, that you really do care about each other, which is amazing, and that you can come together in times like this, that you can work together. It's not a matter of pointing fingers at people. You will come together to work towards cooperating, and when the hospital is reaching out to you saying, don't come to emerge, only if you're really sick, I know that people will step forward. We're looking at other preparedness planning, and we will be engaging with the community because we're going to need the community to come along with us. This situation changes every day. And so we are planning for the future. I also want to congratulate the hospital and the staff because we've worked with them, all the way along. That's what we do every month. They've got their infection prevention and control. They've been practicing it. They live it. It's part of what they do normally, and they do it really, really well. And you see the commitment from all staff to make something like this work. They've got continuity of operations plans, they've got pandemic planning, they've got disaster planning. All of these things people don't know about, but from my perspective, when I see it, they're to be congratulated for, being prepared. And now is the time that this is business that they've practiced, and they to reassure the public that these things are being done. And I just wanted to say it's been a privilege working with you, and I see the work and the effort that goes into it, and everybody's committed to keeping the community healthy. So I just wanted to say that.
Thank you. Yeah, it's teamwork, and that's what we've usually been about. As I've said many times, I've been very proud about this community and the area and how they pull together in times of need, you know, to make sure support so people have food on the table, if that's the case. Or in this particular case, it's protect a community to make sure that we have, it doesn't get out of control, and we're involved. I just wanted to update everyone on a sort of a broader provincial perspective. As president of the Association of Municipalities of Ontario, I was in Toronto yesterday, and we had an update from the Deputy Minister of Health with regard to the situation in Ontario and how that's going. And for those people out there, whether it's you're in a municipality, you can go to the AMO website, and the AMO website will direct you to other information as well with regard to public health and what the province is doing with regard to that. So don't be afraid to reach out, find out more, and we really appreciate that.